Hi, my name is Abigail LeBlanc, and I will be your student nurse for today.
Okay.
How are you today?
I'm good.
All right, can I just get your name and date of birth?
Monica Cotton, 1986.
Okay, and I'm just gonna ask you a couple of questions. Do you know where you are today?
Yes, I'm in the hospital
Okay, and what are you here for?
for my assessment.
Okay, and do you know what year it is?
2020.
Do you know who the president is?
Trump.
Good. All right, and I'm just gonna be here to do your head to toe assessment. And if you have any questions, just let me know. But I'll try to explain as I go along.
Okay.
All right, and on a scale of 0 to 10, with 10 being the highest, what's your level of pain?
0.
Good, good. All right, and off the bat, I can tell my patient is alert and orientated. Her skin is great color for her ethnicity. Her face is symmetrical. There's no drooping, and she has no signs of distress. All right, and I'm gonna start with palpating your scalp. Let me know if you have any discomforts or pain as I'm doing this. Her hair is shiny, non-brittle, and I'm just gonna go down to your ears, palpating her auricle. All right, her tragus, mastoid process. I see that she has piercings but no earrings. All right, and I'm just going to be doing your Perla assessment, which just means I'm just going to check if your eyes are reactive to light. So I'm going to see if they're constricting. All right, from out to in. Good, beautiful. Good, beautiful. Patient's eyes is nice, round, equally reactive to light. And I'm just going to see your ocular movements. So just keep your head straight at me. Just move your eyes, not your head. Good. Follow my pen. That's very good. Good, good. All right, and I'm just gonna check for your accommodation, which means I'm just gonna bring the pin to your nose. Good. Eye accommodates bilaterally. All right, and now I'm gonna be checking your mucous membrane. So you just open up and say "ah" for me, please. Ah. Good. I can tell that your mucous membranes are nice pink and they're very moist, and your uvula is midline, and there's no tonsil swelling in there. Okay. All right, and I can tell that by the patient's speech that her speech is very clear. And do you have any trouble hearing?
No.
Any trouble seeing?
No.
Any trouble with swallowing?
No.
Okay, good. So now I'm just gonna be listening to your heart sounds. Okay.
Yeah.
All right. So I'm gonna start with the second intercostal right sternal border. This is where I can find your aortic valve, and this is where S2 is louder than S1. All right, moving over to the left sternal border, second intercostal. This is your pulmonic valve. This is where S2 is also louder than S1. Moving down to the third sternal border where I can find your Erb's point. This is where S2 is equal to S1. Going down to your fourth intercostal to your tricuspid valve. This is where S1 is greater than S2. Then going over, moving your membrane, sorry ma'am. Going down to the fifth intercostal mid clavicular line. This is where I can find your mitral valve. This is where S1 is louder than S2. While I'm here, I'm just going to palpate your carotid arteries under your neck, okay?
Okay.
All right. And there's no pulse deficits. And I'm just going to be palpating your apical pulse and seeing if they're feeling for your PMI. Good, good. They all sound good. So now I'm going to go over it again with my bell. And I'm going to just be listening for any heart murmurs. And I'm also going to do your carotid looking for any bruits, okay? All right. Going over the landmarks again. This is the aortic valve, pulmonic valve, the Erb's point, tricuspid, and the mitral. And then as I'm going to listen to your carotid, just take a deep breath for me and hold it. Good. And next time. Good. All right. So now, do you have any chest pain or any difficulty breathing?
No.
Perfect. So I'm going to listen to your lung sounds, okay?
Okay.
And every time I put my diaphragm down, you just take a deep breath.
Okay.
All right? Good. Deep breath. Good. 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 All right. 2 more. Good. All right. I'm just going to have you turn around. I'm just do the posterior.
Okay.
All right. All right. And I'm just going to be listening. And right here is the bronchial site where expiratory is louder than inspiratory. And these next 4 sites is the bronchial vesicular sites where inspiratory is equal to expiratory. All right, and the last two is the vesicular site, where inspiratory is greater than expiratory. All right, and I'm going to check to see if your lungs are moving bilaterally. Good, your rising fall is bilateral. I'm just gonna have you turn back around for me, please. All right, and I'm gonna check your upper extremities. So I'm just gonna be touching your, gonna be palpating your shoulders. You're struggling for me, okay?
Okay.
Go ahead. Good. All right, and I'm just gonna go down your arm. Can you feel this?
Yes.
All right. Any tingling or numbness?
No.
Okay. Can you just give me a squeeze? Good. I'm gonna check for capillary refills, less than 3 seconds. I'm gonna feel your radial pulse. Good. They're nice and strong bilaterally. All right. And I'm just going to have you lay down for me so I can check your bowel sounds. Have you had any bowel movements?
Yeah, this morning.
Okay. And then do you have any voiding?
Yeah.
Good. So I'm going to be listening to your bowel sounds in all 4 quadrants.
Okay.
All right. Good. I don't hear anything bad. And I'm just going to go around and I'm going to listen to your arteries.
Okay.
And this is your aortic artery, your renal artery bilaterally, iliac artery bilaterally, and your femoral artery bilaterally. Good, there's no turbulent sounds. And upon inspection, before I palpated, I can see that your stomach was nice and flat. So now I'm gonna go to your legs and I'm gonna palpate your abdomen first. Do you feel any discomfort or any pain?
No.
Okay, good. All right, so I'm gonna palpate your legs and you just let me know, can you feel this?
Yeah.
Good, patient's skin is nice and warm. Do you mind if I take your,
Okay.
okay. And the patient's skin is intact. And I can see that very intact. All right. And I'm gonna feel your dorsalis pedis. Good, nice and strong bilaterally. Posterior tibialis, nice and strong bilaterally. If you can just push down for me. All right, pull up. All right, wiggle your toes. Good, patient's feet is nice and strong. And I'm just gonna look for your cap refills. Good, less than 3 seconds each. And I'm just gonna have you sit up at the edge for me, please. And I'm going to use my diaphragm, and I'm just going to hit it against your knee for your papillary reflexes. Good. Good. All right, any questions for me?
No, man.
All right, you did very well, and I'm just going to wash my hands. But if you need anything, let me know.
Mm-hmm.
All right, thank you. This is the end of my assessment.